My name is DJ.
Hi, I'm Amal.
Hi, I'm Demea.
Hi, my name is Hannah.
Hi, my name is Suad.
Personally, I feel like within the Black community and communities of color, mental health isn't really talked about. It's very stigmatized, and if I can in any way try to break through those barriers and reach people who wouldn't have really thought about their mental health before in any way, then I'd love to do it.
I was already involved with the Annex with work about sexual health and getting involved, and this opportunity came up front and my interest became more broad, more about the health system in general, and I wanted to do something that was action-based.
I wanted to be a part of this project because ever since I was younger, I've struggled with a lot of mental health issues and not really been informed about how to go about it.
I've been a part of a couple of the Annex's projects for a couple of years now, and I was very interested in helping and impacting my community in any way I could.
I was very interested because personally I am going into the mental health field, and anything related to mental health I do my best to have an experience with, because everything is a learning experience. I get to learn not only from myself, but I get to learn from other people.
Recently, I've had a long struggle with my mental health this past year, kind of triggered by quarantine and COVID. I was diagnosed with a severe psychiatric disability, and I had told many practitioners that I felt like the diagnosis that I had was not accurate and it didn't fit the symptoms that I was experiencing. And I had gone to multiple therapists, psychiatrists, psychologists, and I just felt like nobody was listening to me, and I felt very dismissed. I can't help but feel like that's partially because in the medical field, Black women, when they are talking about their symptoms, they aren't adhered to, they're not listened to, and it's just brushed under the rug.
I'm not necessarily sure if this directly happened, but it felt like sometimes when I vocalized the things that I'm feeling, not enough had been done to actually discover what the problem was, and it was dismissed quite quickly. And that could have been a result of implicit bias, or it could have just been a result of not being receptive.
I've visited the emergency room multiple times because I have had mental health issues that have needed extra care. And when I went to the emergency room, just because of those past visits, and it's been a lot actually. As a Black woman, I know that it was some of that implicit bias that made them think the way that they did. And I know that other Black people and other people of color have gone through the same thing because I've experienced it myself.
I kind of had a mental health practitioner that I would go to often, and I was talking to her about struggles that I was having with family issues and things, and she kind of was like, oh, I understand that, but isn't it more so of a cultural thing? I don't know, I kind of felt hurt by it because it's just because it's culture or tradition doesn't mean it's okay, and you clearly see that it's impacting my health and my well-being.
I once went to see my primary to talk about my experience with my mental health, and kind of alluding to the fact that I thought that I had ADHD, but instead I got diagnosed with depression, and I was prescribed antidepressants, and that was not it for me. I had a lot of side effects. It really messed with my gut, and it just didn't feel like it was helping me at all. It made my mental health worse. I took a break from the meds and I went to a whole different clinic. I made sure to advocate for myself, talked about specifically and explicitly my symptoms, and I felt that I was listened to there, and I got the right diagnosis and the right treatment, and I feel like I'm in a better spot.
As a Black woman, because those two identities are very, particular and specific to me, it's difficult to come out about those things because Black women in society are meant to be strong, meant to be independent, meant to just have this like resilience that's honestly just superhuman. And when Black women are vulnerable, it's seen as being weak or, not fulfilling the societal standards that we're upheld to. I feel like I would have more difficulties if I didn't have insurance, but thankfully I do. So mental health care, like access, has been accessible to me, but I know a lot of people in like the same financial situation maybe or worse than I am would have difficulties if they didn't have a parent or they themselves were, on insurance.
My class has affected the way that I am able to access mental health. Because of my mom's work, she gets really good insurance, and I know I'm fortunate enough to have like access to a lot of different services. That definitely opened a lot of doors for me and allowed me to get the care that I need. Being Black, there's not a lot of Black practitioners for me, and so I think that has had a disconnect in the way that I receive care.
I think the way that we have to be so persistent, it's just way too much. I don't have to explain myself over and over again, only to get the same answer from the same doctors or different doctors. I think that as a Black woman specifically, like, they don't listen as much to me, and they have a lot of assumptions in their head about what is going on with me, and I just wish that they would listen more and ask questions that would help me get to the root of my problems.
I mean, we already know there's a lot of implicit and sometimes explicit bias within the healthcare system. Depending on the insurance or what you can and can't afford, that can definitely affect the kind of treatment and the health plan that you're going to receive. And that is very, classist in and of itself. For someone who grew up poor and on welfare, we basically had the minimum and the basic kind of healthcare plans, dental care plans. Some of the places that we were allowed to access or that took our medical plan weren't always, the best of places, but it was what we could afford and what was, accepted.
I think trauma-informed care is very important, especially in BIPOC communities, because BIPOC individuals experience disparities, whether it be trauma from living in poverty for an extensive period of time or racial trauma. I feel like they themselves might not even know what they have experienced as trauma, and they might be suffering from these symptoms, and having people around them and practitioners who are trauma-informed will help them understand themselves more.
I think the most important part of trauma-informed care is active listening and being informed and understanding your patient and taking into account what your patient is saying rather than what information you may already have.
I think it's very, very important that they provide trauma-informed care. Not only is it something that I needed when I was younger, but I know that other people need as well.
I remember I was in the mental hospital and I was talking with a family therapist, and I was talking about parenting styles within the Black community and how some of them can be harmful and trauma-inducing. And my white therapist was attributing the abusive parenting styles to culture, and I feel like she tried to be, understanding. It also dismissed that how traumatic corporal punishment can be, authoritarian parenting can be, and I feel like that is an example of what wouldn't be trauma-informed care, but what would be her understanding that these patterns exist in the community, but also acknowledging that these are harmful to children who grow up in that environment.
To me, that would look like somebody who's listening actively, being able to set up and help me curate a treatment plan that best fits me and not always what works for the majority. Also, I feel like involving community as well as family, I think that's also a big thing. When it comes to trauma-informed care, a lot of people feel lack of support from their own family or friends, or may feel that they can't go to them. and that can cause a lot of isolative behaviors and feelings. And by involving someone's support system and their community, that could really help them as well.
I think asking the right questions is something that should be put into place. Moving on from subjects that are really traumatizing or very sensitive subjects should be handled with care, and just actively knowing what kind of trauma is going on with that person and asking the right questions, yeah.
You are educated on what trauma-informed care is. You also are you're educated in what equity is, not just equality, the culture, the background, and where different races and ethnicities come from. And I think that's what trauma-informed care would be for me. A way that I kind of know that if someone's actively, listening, I feel is not just nodding and being and writing stuff down. For example, my arms worker writes down and types down everything that I'm saying, but I don't know if they're processing it. So a way for them to do that is kind of give a little more reassurance, take a break, think about what I'm saying and process it and add in your input. Whenever I'm talking to other mental health practitioners, they have to write down everything I'm saying, but it just doesn't seem like they're understanding me.
Some of the themes that stood out is just the commonality of having to be persistent and continuously vocalizing your need to the practitioners more than you have to. More than one of the people that I had talked to talked about how they had to continuously ask for the same thing over and over again.
They themselves were kind of new to the idea of what trauma was and what trauma-informed care was. I was really surprised about the ignorance and the lack of knowledge, and how basically uninformed kids who probably have gone through trauma knew so little about what trauma was.
I just think that if we can put more information out there, that more people will be able to access that kind of care who need it, and also those who just need to know about it.
The main theme that stood out for me is just people talking about the lack of access they had to mental health. And by people, I mean specifically Black people, because most of the people that I interviewed and talked to about this were Black people, and they were talking about how they didn't have any insurance, or how their therapist or doctor, psychiatrist were white and didn't really understand where they were coming from.
Most people felt or didn't feel comfortable really going in depth about the stuff that they've been going through. So I heard that a lot of people were holding back more than really telling their providers exactly what's going on with them, because they felt that they were not going to be listened to, and had previous experiences where they weren't listened to and the treatment that they received wasn't up to par. I feel if people had a better space and a safer space to really speak on what they're going through, then their treatment plan would be a lot better.
There's a lot of services for people who have more common, more socially acceptable psychiatric disorders like depression, anxiety, and there's counseling for that. But I know from my experience and experience of other people who have severe psychiatric disorders, it's hard to find someone who is equipped to work with an individual and process what an individual who has a severe disorder needs. So I feel more practitioners who have the capacity to work with individuals with more severe psychiatric needs.
A lot of people prefer to have someone that is of the same race as them as their care practitioner, and that is something that cannot always happen. And on top of that, things like therapy and getting different services are expensive, and a lot of people don't have the money and the resources to have those things.
Class barriers, especially with insurance. I'm very, very lucky to have insurance that covers my mental health.
Because there is limited access, and insurance most of the time doesn't cover all of the stuff that you may need.
I think first it starts off with the healthcare system, having more properly trained people in trauma-informed care, as well as having more providers and people in the healthcare system that represent the community and BIPOC as a whole. I myself don't think there's not enough representation. I haven't seen it. I know a lot of people, when they do come across a provider who looks like them or who understands them, they always talk about how it was a better experience for them. They felt like they can talk more. They felt like they can be more comfortable in speaking up for themselves.
I think they have the experience, but they don't have the knowledge. You can have experiences working with these people, but whether or not you gained anything from that experience is what matters, and I don't think that has happened enough.
If you are a practitioner, specifically if you're a practitioner who is not of color and you are working with youth of color or any adults of color in the mental health field, I think it's really important to listen to their experiences because they know themselves and what they've been through more than anybody else will.
Listening is key. Make sure that you are listening to the person who is seeking care from you. You make sure that you are informed, ask the right questions.
As a practitioner, you have a duty and a job to care for your patients, and this is one of the ways to do that. Letting go of your own ideas and your own pride might be helpful, just because as a practitioner, you have to put your patients first.
Listen to what your clients are saying. Have equity specialists coming in and having maybe monthly trainings and stuff on that.
Making mental health a lot more affordable. I know certain insurances, if you have like Medicaid, does not cover everything. Anything can be made into a business. Hospitals are a business. Therapy is a business. Going to the doctors is a business. So when money is involved, I think that can take away a lot of empathy and creates a lot of apathy for people and the different things that they're going through. Making sure that people are actively working on their empathy and their listening skills can really help better someone's skill in being able to properly give trauma-informed care, because then everything is person-to-person basis, situational.
Thank you so much for taking the time out to watching this video, hearing these amazing young people's stories and their suggestions for you. Being a trauma-informed organization takes more than just knowing that the young people that you work with have experienced trauma. There's other things to consider, like intersections. Intersections of someone's identity deeply impacts the trauma that they've experienced. There's a really good TED Talk by Kimberly Crenshaw who coined that term that you can find on YouTube to get you started. Also thinking about when you work with young BIPOC youth, thinking about intergenerational trauma. As the young people have expressed that sometimes practitioners who don't share the same culture as them deem some of their trauma as culture. Also understanding systemic trauma. These young people are experiencing trauma just from existing. Also knowing that when they come through your doors, you are a part of that system. There are other ways that you can be more trauma-informed in your practices. Some suggestions are having BIPOC youth as a counsel to your organization. Let them help guide some of your practices and procedures. Thinking about having a client or patient satisfaction survey. Hearing directly from the young people that you serve could help better your practices. And then lastly, involving BIPOC youth in your strategic plan. As we all know, our organizations have to have a strategic plan, and when BIPOC young people are at the table, they are impacting the processes that you have at your organization. To be engaged in this work, there's reflection that should happen, especially for white and privileged practitioners. To get you started, you could read some books like White Fragility by Robin DiAngelo, the Me and White Supremacy Workbook by Layla Saad, and you can find that on Amazon. This is hard work, and I know that you are committed to it. So thank you for your time, and please keep having these hard conversations.